Welcome to your pre-op teaching video for your upcoming facelift with laser. This talk may feel a little overwhelming, but remember you can watch it over and over again so you're sure you understand everything going into surgery. Before your pre-op appointment, if you needed to get clearance from your physician or an ophthalmologist, make sure you have that in the works. Be on your skin prep of your retinoid and hydroquinone to encourage good healing without complications. Don't be a smoker. If you needed to gather up an old EKG or any lab work, please get on that. And there's an additional ablative laser video that's super important for you to watch as well. Read all of your paperwork, including your consent form, and be sure to bring any questions you have to your pre-op appointment. 2 weeks prior to surgery, be sure to stop all blood thinners and herbal supplements. Common over-the-counter blood thinners include aspirin, ibuprofen, fish oil, and vitamin E. Reduce your alcohol consumption and consider even stopping completely the week before and after your surgery. Review your teaching material, and again, create a question list so we can go over those specifically at your pre-op. It's good to have a wedge so you can sleep with your head of your bed elevated if your bed doesn't adjust. Get a soft travel pillow and get the one with the little microfiber beads in it, not memory foam, because the memory foam's a little too firm. You'll want a nice selection of cold compresses, some gauze pads, and some washcloths. There are a lot of over-the-counter medications that are helpful, including Tylenol, Dramamine or Bonine, which are anti-nausea medications, have some antacids like Tums or Pepcid, and some antihistamines, including Zyrtec or Claritin and Benadryl. It's good to also have some eye products like saline eye drops because you might need to rinse some of the aquaphor out of your eyes. If you're having eyelid surgery, get some eye lubricants because you may be using these for a few months after surgery. Something like Genteel or Sustain or Refresh work great. If you're having eyelid surgery, I will also give you a prescription tube of ointment after your surgery. In our dry Colorado climate, it can make healing from a laser a little more difficult because your skin has a tendency to dry out faster. So if you can get a humidifier or cold air vaporizer that you can keep by your bed, that's great. Also get a bottle of white vinegar because you can put a little splash of this in your ice water that you put your gauzes in, that you put on your lasered skin, and that helps take the sting out and actually kill some bacteria. We're going to give you a big container of Aquaphor, but you can never have too much. So you might want to get an extra tub at the grocery store. If you have super sensitive skin and get rashes easily, you might want to wash your bedding and your towels with a hypoallergenic detergent, or just run it through the wash a second time without soap, and don't use fabric softener in the dryer. Now, Arnica Forte is a homeopathic medication that we'll give you at your pre-op appointment, and this helps to decrease swelling and bruising and speed your healing. The bromelain component contains pineapple and papaya, and there's also traces of wheat in it. So if you have food allergies to any of these, you may want to skip it. You'll start this by taking 2 the night before surgery, and then you'll continue this twice a day until it's gone. You can also get arnica and bromelain separately at the health food store. We will give you your prescriptions at your pre-op as well, and fingers crossed there will be a time when we can just transport these electronically to your pharmacy. You will likely get a prescription for an antiviral to help prevent cold sores, an anti-inflammatory which helps with pain, a muscle relaxant which helps with pain, and a narcotic painkiller. On top of this, we will also give you a prescription strength anti-nausea medication. Valtrex or valcyclovir is the antiviral that we use to help prevent cold sores. It's used prophylactically, and you start it the night before surgery and continue it until your skin is healed. If you break out with cold sores pretty regularly, it's smart to start this 2 or 3 days prior, and don't hesitate to get a refill on this if your skin is not completely healed by the time your prescription is done. Tylenol or acetaminophen is going to be one of the things you'll use for pain. It's important to know that Tylenol comes as a regular strength of 325 milligrams or an extra strength of 500 milligrams per pill. We recommend taking 1,000 milligrams 3 times a day for at least the first few days after surgery. It is important to never take more than 4,000 milligrams of Tylenol in a 24-hour period. That's 8 extra strength Tylenol pills because it can be quite hard on your liver. So this is a medication that we recommend starting the morning of surgery, taking 2 extra strength or 3 regular strength with a tiny sip of water before you leave for the hospital. Celebrex is an anti-inflammatory that helps with pain, and this is an optional medication, but it can be very helpful. I like to describe it as designer ibuprofen because each one of these pills lasts for an entire 24 hours. It has less bleeding than the typical other nonsteroidals, and you only need to take it as needed or PRN. The dose is based on your age and kidney function. If you're under 65 years of age, it's fine for you to take 1 pill twice a day as needed. If you're over 65, we want you to limit it to only 1 pill every 24 hours. You'll start with 2 pills the morning of surgery before you leave for the hospital and a tiny sip of water. If you're over 65 or your kidneys aren't functioning completely normally, we'll ask you to only take 1 pill. If you're under 65, this is a medication you can resume 12 hours later. And if you're over 65, this is a medication you can resume the next day. Valium or diazepam is a muscle relaxant and anti-anxiety medication. You can take 1 5-milligram pill every 6 hours as needed. Because it's sedating, you want to make sure you don't take it at the exact same time as your narcotic pain medication because the combination may make you a little too sleepy. Also, don't take this medication with other anti-anxiety medications or sleeping pills like Xanax, Ativan, or Ambien that might already have been prescribed. It's also important not to use THC while you're on these other medications. If you remember that Rolling Stones song, Mother's Little Helper, this is what they were singing about. So we do like to limit refills on this prescription because it can be very addictive. You'll also be prescribed a narcotic pain medication. Most commonly, we use oxycodone, which is the same painkiller found in Percocet. You can take one of these every 4 hours as needed, and it's actually okay for you to take 2 at a time if your pain is severe. You may have a different choice, like Ultram, which is weaker, Dilaudid that is stronger, and some people prefer something different like Norco, which used to be called Vicodin. Just as a reminder, that medication only comes with Tylenol in it, so you won't be taking Tylenol around the clock as we prescribed earlier. It's important to know that we cannot phone in narcotic refills, so if you're running low and it's getting close to a weekend, make sure you send someone in to pick up another prescription for you. It's actually pretty uncommon that people take their narcotics more than the first day unless it's at night to help them sleep. Now, remember that it's the patient who should decide if and when something like this is needed. The goals of pain control are to decrease moderate to severe pain down to something that's a lot more tolerable, but it's not that it should make you pain-free. And please don't take narcotics to help treat anxiety. Narcotics can have a lot of side effects, including nausea, oversedation, decreased respiratory drive, itchiness, constipation, and addiction. We'll also give you a prescription anti-nausea medication called Zofran ODT. The ODT stands for an oral dissolving tablet, so all you need to do is place one of these tablets underneath your tongue and it will be absorbed. At the hospital, we might also use something called a scopolamine patch. It looks like a little spot Band-Aid. They'll put it on your arm under some sticky saran wrap, and it'll work for 3 days. It does have a lot of side effects, including dry mouth, blurry vision, urine retention, and confusion. And these side effects are worse when people are older. So we may leave it off altogether for older patients. Now, when you take it off your skin, make sure you wash the area with soap and water. Wash your hands and don't throw it somewhere where a pet may get it out of the trash, because if they eat it, it can make them sick. So remember, we also asked you to pick up either Dramamine or Bonine. Now, this is the good thing. All of these anti-nausea medications could be taken at the same time if necessary. We certainly don't want you throwing up after surgery, so if you try one and it doesn't quite work for you, feel free to try another. Now, this is also a kind of a cool little thing that you'll get at the hospital when you wake up from surgery. It's called soft pulse, and it generates this little electromagnetic field, which you don't hear, you don't see, and you don't feel, but it works to decrease pain and swelling. There's just a single on-off switch on it, and the battery will last probably about a week to 10 days. You'll wear this around your face for really round the clock, maybe just taking it off when you're in the shower, and that's going to help speed up your healing. When the battery dies and the little blinking light finishes, and it's not blinking anymore, you can just throw this in the trash can. The night before your surgery, it's important to know when you can last eat or drink, or what's called your NPO orders. So for food and full liquids, including things like milk and orange juice, you need to stop 8 hours prior to your surgery. You can continue to have clear liquids, which includes water, Gatorade, apple juice, tea, black coffee, and clear Jell-O, up to 4 hours prior to your surgery. Now, we know that a little caffeine in your system and a little bit of sugar in your system can actually help you wake up a little bit more comfortable after surgery. It's also important the night before surgery to start your Valtrex, which is for cold sores, and your Arnica Forte, which is for bruising and swelling. Know your arrival time and place, review your instructions, and you may get a phone call from your anesthesiologist the night prior to surgery. On the morning of surgery, we want you to get your hair and around your ears as clean as possible. So take a shower and wash your hair with an antibacterial soap like Dial. You can also take some of the HibaCleanse soap we give you in that little packet, put it on a washcloth, and really clean in front and behind your ear and into your hairline. After you're nice and clean with that, go ahead and put your normal conditioner in, and don't style your hair or put any styling products on. Because you're having a laser, we don't want you to put any lotion or sunscreen on, but do apply some hydrating serum, which is the Revision little black pump bottle, and that's fine on your skin when you come into the hospital. If you have longer hair, bring some ponytail holders you don't care about, and I would wear clothes that are easy to get in and out of, like a zip-up hoodie. You'll also want to take 2 extra strength Tylenol, a Dramamine, and 1 or 2 of the Celebrex based on your age, with a tiny sip of water before you leave for the hospital. Also, there may be some of your regular medications we want you to take or avoid that morning, so we'll go over that with you specifically at your pre-op appointment. You'll want to bring with you a form of identification, your Arnica Forte, and the OmniCore Recovery Complex. Also, if you're on any unusual regular medications that might be brand spanking new or kind of rare, you can bring those with you as well in case they're not on the hospital's formulary. But do not bring your pain medication or Valium or anti-nausea medication that we prescribed for you for home use. You'll be staying overnight in the 6 North Suites, which is a very nice part of the hospital. The goals are that we can control your blood pressure, control your nausea, and treat your pain. It's also really great to have a nurse helping you with your lasered skincare. You'll likely have drains that I will remove the next morning for most patients, but I might send you home with these to take out at your first follow-up appointment, which is typically 4 days later. It's fine for you to shower as early as the next day, and everything can get wet. This is the perfect time to clean your lasered skin. So take a gauze pad in there with you. Make sure the water is not too hot, and as you can splash water on your face and use that gauze to just kind of wipe away the old Aquaphor. After your first shower, you'll start using that core recovery complex, and there's enough in there for probably 2 showers. Now, remember that a goal for your lasered skin is not to let it dry out. So if you find your skin is getting really dry, just take more showers during the day, because this is a great way to moisten your skin and to get the crustiness off. If you're having a face and neck lift, we'll put some antibiotic ointment on your stitches that are around your ears and under your chin. But once you leave the hospital, it's fine to just put Aquaphor on these incisions as well as your lasered skin. We want you to avoid any kind of straining, and we don't want you to lift anything heavy. I'd like you to elevate the head of your bed so your head is higher than your heart, and you can use a wedge, and that soft travel pillow can go underneath your neck if you want to. Also, a recliner is a great position. That travel pillow also works great as you're healing down the line, because your ears are going to be super tender. So once you're sleeping on your side, you can put the ear in the middle of the hole on the travel pillow, and that can be super comfortable. It's important that you keep your chin up. The angle from your chin to your neck and down to your chest should be 90 degrees or greater. And try as much as possible to turn at your waist, not at your neck. Don't do a lot of chewing, and try to stay on a low salt diet, because that can make you pretty puffy. And use cold compresses as much as you possibly can. That can go with the wet gauzes on your lasered skin, but you can also use wet washcloths that are icy cold on your neck and on top of those facial gauzes. You'll use that soft pulse for 7 to 10 days after surgery, and we do like maintaining blood pressure lower than 160 to 170. So if you find that you're running consistently high, we may involve your primary care to help us with some medications, or we may use a special patch for the initial week after surgery. So it's not super dangerous for your blood pressure to be that high, but it can increase the risk of bleeding, and your primary care wouldn't want you walking around that high on a daily basis anyway. Now, we have this separate video that goes over all of the products we give you for your laser healing, and I would absolutely watch that multiple times. It is super, super helpful. The big takeaways are: don't let your skin dry out, so you're doing the Aquaphor around the clock, and this may be 5 times a day, maybe 20 times a day, based on what you want. You want to be doing kind of the thickness of making a peanut butter and jelly sandwich. Also, the cold compresses are good for pain, and with a little vinegar, it can help soothe your skin, but it also helps you to clean off all the exudate or the drainage that's coming off your skin. Remember that humidifier, and take as many showers a day as you need to help keep your skin clean. So once your drainage starts to go down on your skin, and that's going to be fastest in your cheeks and on your forehead, slower around your mouth and around your eyes, you can transition to the Elta MD moisturizer, which we refer to as Aquaphor Light. So you may still be putting Aquaphor around your mouth or around your eyes for a couple of days, but you can go to that lighter moisturizer, which is not quite as greasy and a little nicer to tolerate. So once your skin is healed, and you can tell by when you get out of the shower and you wipe your skin off, it stays dry and there's no longer weeping that accumulates on the surface of your skin, you can transition to the medical barrier cream. If people keep putting a lot of Aquaphor on their skin and their skin has already healed, you tend to get kind of rashy and itchy. So it's not good to use that too long. If you're having surgery around your eyelids, like an upper blepharoplasty, lower blepharoplasty, or a brow lift, expect that you'll see some bruising, puffiness, and your vision may be a little bit blurry. Now, it can be very difficult to close your eyes all the way after these surgeries, and it's imperative that you don't let your eyeballs dry out, because this can be super uncomfortable. So During the day, you can use saline drops if you need to sort of rinse the aquifer out of your eyes or moisten your eyes and you still need to see. But at night, we want you to use something more gooey like the eye gels or eye lubricants like Genteel, Sustain, or Refresh. And you might even keep using these for a couple of months after surgery. If you're having upper or lower eyelid surgery, I will give you a little tube of a prescription ointment to either put on your sutures or if you're having your lowers done in your eyes at night and during the day if they're irritated. Now, the ointment we give for lower eyelids does have some steroid in it, and that steroid really does soothe your eyeball, but it can be bad for your eyes if you use it too long. So we recommend you only use this for about 1 week. You can also do cold compresses directly on your eyes to help with the swelling and the bruising and the discomfort. We don't want anyone wearing contact lenses for at least 2 weeks after their surgery. So what do you think you're going to look like after the surgery? I'll tell you, you certainly will not look like this. You'll probably more likely look like an extra from The Walking Dead. Now, don't be alarmed, it's not going to look like this for long, but I described the first day as looking like raspberry jellies on your face, and then by about day 2 to 4, you get a creamy exudate on your skin that looks a little bit like frosting or what I call the oatmeal phase. That's eventually going to slough off in the next couple of days, and it will be replaced by red, shiny, pink cherry looking skin. So what's normal after this surgery is some pain. I would say the first 24 hours is absolutely the worst, and then people get significantly better after that. You'll probably have a sore throat, really tight muscles down the center of your neck, and some pain behind your ears. It's also common to have bruising, and that bruising tends to get a little worse over the first couple of days, and swelling that tends to get a little bit better after a first couple of days. But having your eyes super puffy is normal. They may actually be so puffy it might be hard to open them and see. The combination of swelling and all of that greasy stuff on your face will absolutely make your vision blurry. Some of the medications that we use for anti-nausea can also give you a little bit of blurry vision. Your face will look a little bit asymmetric and may move a little bit asymmetrically, and you may have patches of numbness and tenderness. Now, the lasered skin, again, is going to probably look its worst at about 2 to 4 days. So what does concern us is a hematoma or arterial blood that accumulates underneath the skin. This is a picture I stole off of the internet, and you can see that the right side of her face is much more swollen than the left, and this is firm and will become very bruised. Typically, this happens in the first 24 hours, which is why I like you staying in the hospital. Again, any kind of straining, vomiting, high blood pressure can cause a hematoma to happen. So that's why we ask you to be so careful about all of those things. It may start in your neck or in your cheek, and it can quickly spread to other areas. So we consider this an emergency, and I need to see you right away if this happens. Some people see a little bruising, see a little puffiness, and they think it's a hematoma, but this is pretty alarming and pretty severe when it occurs. Also, you may end up getting a rash. We talked about a little itching that might happen with the pain medication, but if you start getting a rash on your body, this could be due to an allergic reaction from a medication. So we want you to stop everything, start those antihistamines, and give us a call. You shouldn't expect to have chest pain, shortness of breath, or pain in your legs. So if you experience this, it could be a sign of a blood clot. A low-grade temperature of 99 may be totally common, but if you're getting higher towards 101, we need to hear from you. What's not an emergency is what we call a seroma, or the fluid that was coming out of the drains that's a little bit watery. Sometimes that can reaccumulate after the drains come out, and it looks like some swelling low in your neck, and when you touch it, it kind of jiggles or gives a wave like a waterbed. Now, this is not an emergency, but it's something we don't want you to wait like a whole week before you come in. So call the office during the next business day because we can slip a little needle in there and suck that extra fluid out to speed your healing. Also, again, we want your blood pressure to be less than 170. And if you see it consistently high, it's not an emergency, but your primary care and us, we all would love you to have lower blood pressure like that than that. So give us a call and we'll talk about different medications that we can try or include your primary care in the decisions. For driving, it's probably best not to plan on driving for at least 1 to 2 weeks. I did not drive after my surgery for 10 days. And it wasn't because I was on pain medication. You definitely don't want to drive if you're taking your narcotics or your Valium, but we don't want you turning your head to look over your shoulder. We want to discourage that much movement. So even if you have a backup camera, it may not be super safe for you to be driving those first 2 weeks. You also have to make sure your vision is clear. So use good judgment because your reaction time may be slow. Your first follow-up is 4 to 5 days after surgery. And if you want your nurse to be your best friend, take a shower immediately before that appointment and don't put the Aquaphor on the sutures around your ear and under your chin because that can make it a little harder for them to see those tiny little sutures. When you come to that appointment, we are going to discuss what to do on the next steps with your skin. We're going to encourage you to still keep your activities at a minimum, and mostly we'll be providing a lot of reassurance because people are rightfully very concerned about the way they look. Your second follow-up is about a week later. So that's going to be at about 10 or 11 days. Now, you may be doing great and want to drive yourself. And if you're meeting all the criteria, you can, but don't be afraid to ask for a ride. At that second follow-up, we'll be taking out any sutures or staples you have in your scalp, and we'll talk about what to do for scar care that we like starting at 2 weeks. So most commonly, this is going to be our biocorneum silicone gel that has sunscreen in it, and you rub it on your facelift incisions twice a day. We also may give you little pieces of silicone gel to use on your eyes if you had your upper eyelids done. The eyelids don't really like these scar creams, so we typically will use silicone. And what's nice about that sticky silicone strip is it can help to hold your eyelids closed at night so you don't experience dryness. We'll also talk about the next steps for your lasered skincare, which will include incorporating back your sunscreen, adding some growth factors like the Neocutis line, and then eventually returning to your hydroquinone, which is the skin bleaching cream, and ultimately the retinoid maybe at about a month to 6 weeks afterwards, so you can use these skincare products to maintain and continue to improve your results. All right, you are officially well prepared for your surgery. Remember, you can watch this video anytime you want. It's on our website on the patient education page under the Learn tab under pre-ops. Be sure to bring any of your questions to your pre-op appointment. And I'll tell you, if you have someone helping take care of you after surgery, they absolutely should watch this video as well. We expect someone to be there for us to do the right thing, yet rarely teach them what they need to do. Be sure you have enough time off to help you heal the way you need to, and by all means, follow your instructions after surgery.